are we making an assumption that the same approach is equally relevant to all different types of cancer, or is there a specific approach to different beasts?
No, I mean, I think from what we know and what we're going to know, that even for rarer cancers like lymphoma, that the best approach is going to be to adopt a healthy plant-based diet and limit, the carcinogens in the diet as much as we can. I mean, we're only really ever going to get observational data in that setting. And actually, I've written an article of what we know about non-Hodgkin lymphoma and the impact of diet. I'll send that to you afterwards for your
please,
email that goes out. And it's very much sort of observational data, but it's all along the same lines. We're never going to find a study that says eating red meat is okay for cancer. So I think the broad approach, and I think it would be nice to have randomized studies in each different cancer, but it's just not going to happen really. The big three, prostate, colorectal and breast cancer, is where we've got the most data. And so, for example, the Women's Health Initiative study, you may know about this, it's the largest nutritional intervention study and the most expensive ever conducted in postmenopausal women, about 50,000 women, followed for over a decade now. And in that cohort, people who were eating a healthier diet with more fruits, vegetables and whole grains as part of the intervention group did better after a breast cancer diagnosis. They lived longer and had a longer remission compared to people who were eating less of those healthy foods. So we've got a bit of supportive data from breast cancer. And of course, colorectal cancer, when you think that more than 50% of cases could be prevented, we've got that data, then it makes sense that even after a diagnosis of colorectal cancer, you want to pay attention to your gut microbiome and avoid the foods that may have contributed to it in the first place. So you want to concentrate on a fiber-rich plant-based diet. And that's also borne out in the kind of observational studies that have followed people after a diagnosis of colorectal cancer.